Our presentation is on pollution's effect on childhood asthma.
We decided to conduct further research on this topic since there is a staggering amount of children in the Central Valley visiting the ED for respiratory-related issues. We have not yet pinpointed why the gap in our knowledge occurs, but we believe that it may be due to some of the unique factors the Central Valley suffers from. One of them being environment and the other being the agricultural industry. The agricultural industry alone brings in two of the worst greenhouse gases, nitrous oxide and methane. Because of these factors, we believe that by studying the effects of said greenhouse gases on air quality time, we can help determine the effects of poor air quality on human health. We can reach a conclusion as to why there is such an extreme rates of childhood asthma in the valley in comparison to the rest of the state. So the purpose of our presentation is to answer the question, how does pollution rates affect the respiratory health of children within the San Joaquin Valley? In order to answer this research question, we use the asthma ED visit rates data from children 18 and under in the San Joaquin Valley to represent those who are affected by the respiratory health. We went ahead and used the air quality data points from the San Joaquin Council of Government Annual Air Quality Index. To keep the data more accurate, we extracted certain counties to ensure that the same counties were being compared. We also had to go through the data and find the averages of every county to make sure there was no repetitive data. After this, the data was over-averaged once more to find the yearly rates overall.
This graph represents the average amount of visits where children had to visit the ED due to issues regarding their respiratory health. The x-axis represent the years, and the y-axis represents the rates of patients going to the ED. As we can see from the graph that there is a peak of patients due to the year of 2012, which may have been caused due to the Tulare County having very high rates at the time, and which could have also thrown the average off. As despite from the data, we can see that the average patients visiting are currently increasing from the year of 2011 to 2016. This graph represents the air quality rates within the San Joaquin Valley during the years of 2011 and 2016. Once again, on this graph, we have the x-axis, which represent the years of 2011 to 2016, and the y-axis having the actual air quality rates. From the graph, we can see that for 2 years, they're having a trend of having the same air quality rate, and there is a peak during the years of 2013 and 2014, which we're currently still unaware of, which could have caused the peak, but we are trying to find the original source, which would help us to resolve this issue. This graph also experiences a very lowest point during the years of 2011 and 2012, which could have been expected due to the years having very less pollution rates due to less pollution causing objects at the time.
Looking at the graph, we have our ED visit rates as our dependent variable and the air quality rates as our independent variable. From the graph, there is a noticeable trend where ED visit rates heighten while air quality worsens. From this, we can assume that pollution and the number of asthma-related hospital visits have a direct correlation. Our findings are relevant since it provides a relationship between asthma-related hospital visits and the pollution within the San Joaquin Valley. We are able to conclude this from seeing the inverse relationship that occurs when comparing the two data sets, that of ED visit rates and air quality rates. This conclusion confirms our earlier hypothesis because it shows that pollution does in fact affect respiratory health within children in the San Joaquin Valley.